So the effleurage. So we do 6 repetitions of the effleurage, making sure that we avoid any sensitive tissue. Still, don't forget to transfer your weight. And then after the 6th one, we're going to then lift the arm above the elbow. So we take the arm with the left hand and lift, and we cradle into our left arm. Okay? And you may have to take a little slide step to get to the point where you need to be just relaxed, just let your arm go. It's fine. And then we start doing this lovely palmar kneading around the biceps. Okay? So at all points, you're not grasping her hand, but you're just resting her hand on your hand, but her arm needs to come across your arm, okay? And then we drain towards the axilla nodes, which are lymph nodes, under the armpits, okay? Then we support the elbow and we allow the arm to drop. We don't do anything with our hand to try and put the arm anywhere, because we've got sensitive breast tissue here, so we certainly wouldn't lay our hand on that area, and we just allow it to drop. The support comes from the fact that you've held their elbow, okay? Then we work the biceps.
Is that palmar kneading again?
Palmar kneading. Yeah,
Heel of your hand?
It's heel of hand more so than palmar,
Yeah.
because of the nature of the thickness of, I mean, if you're doing it with a man and they're quite muscle bulk, you will be able to get more of a palmar knead, but our pregnant's got lovely slim arms, so it's easier for me to do the palmar, the heel of hand kneading, okay? And then again we drain towards the axilla nodes.
Circular thumb frictions around elbow.
And then we do thumb frictions around the elbow. So these are these lovely frictions that we do around the patella, do you remember? And then we slide over,
That's nice.
supporting the elbow at all times, slide over. And next.
Lay arm on couch and effleurage whole arm.
So lay arm on couch, support the elbow, okay, and then effleurage the whole arm. So again, three sets of 2, and then what comes after that?
Picking up from wrist to elbow.
Okay. So when we're picking up from the wrist to the elbow, it's on this sort of muscle tissue around here. So we need to just support the lateral side of the arm to stop it flaying off the couch, okay? So it's just literally picking up. And it's on the upward stroke, so we smooth down and we pick up on the upward stroke, smooth down. So you do this repetition 3, and then we have
Drainage on inside of arm to suture.
So, when you've done that, you cradle her hand slightly away from the couch, and then you do this lovely drainage. Now, you can do it without supporting the arm. For some reason, the arm just seems to rest and lay there. And this is like the drainage that we do on the gastrocnemius and the soleus, yeah? So we're draining to the subtrochlear lymph nodes. And then we do...
Thumb, knee, wrists, plantar followed by dorsal.
Right, so plantar, relax. Okay. So plantar, so thumb knead, the wrist area. You know, this is the thumb kneading that we've done before around the scapula. And then when you turn over, It's always nice when you turn over just to smooth their hands so that they aren't actually balling a fist. Okay. So you do that 3 times, yeah. Follow.
Drain tendons and dorsal side from thumb to little finger.
So again, it's this lovely drainage. You know, it's nice to support the joint area with the hand so that it's resting. Then you can do this sort of drainage like this, like so it's half of a alternate thumb lead, or you can just drain like this. Okay. So you do that 3 times. Then we have
Interlock fingers, passive flexion, extension, rotation of wrist and
right.
stretch.
So you hold the elbow, hold the wrist so that it's facing you with your left hand, and you interlock with your right hand. Okay, and then we do flex, extend, flex. You need to hold the joint because if you don't, you might over rotate the joint. Okay, so make sure that your hold is around the joint area so that you're just doing a small flex, extend and rotation like you did with the feet. And then we have,
Thumb, lead, palm, side of hand.
right, okay, so we pull,
What's the stretch? Oh, yeah,
this is the stretch here, okay, nice slow stretch. You don't have to pull the arm up off of the couch, and then we turn over, and then we link one hand into cradle the back of the hand, the finger into cradle the back of the hand. This opens up the palm completely, and then we do this lovely thumb kneading all the way around the fleshy areas of the palm of the hand. Now, if you might find that difficult to start with, so if you just want to do this, it's absolutely fine. So if you just want to cradle the hand, but what that does is really stretch it out, okay? But by taking the little finger down and cradling, little finger down and cradling, really opens up the palm. And this is really good for people that work on a keyboard or do some repetitive work, computers, yeah. Any repetitive work, I mean massage therapists, it's
Pianist.
really, pianists, lovely, really lovely work. And then we have,
Effleurage arm.
there we go. So at this point, you support the underarm, the underside of the wrist, and then again you smooth off, so that when their arm goes down, you've got a flat hand, okay? And then we'd finish off with these lovely 6 effleurage. And then we cover. How can we do it? There we go, and a little bit of a stretch afterwards, as you do on the leg. Okay, all right.